Incoming. Multiple trauma. ETA 3 minutes. The emergency department radio crackled with urgent communication as Metro General Hospital prepared for what dispatch described as a multi-vehicle accident with 8 critical patients. The night shift staff began scrambling to clear trauma bays, but Lisa Rodriguez, the ICU nurse who had volunteered to help with emergency overflow, remained perfectly calm behind the triage desk, her hands already moving to organize trauma response materials with systematic precision that seemed almost military in its efficiency. All available staff to trauma bays 1 through 4, announced DR. James Patterson over the intercom, but Lisa was already 3 steps ahead, implementing a mass casualty protocol that none of the civilian medical staff recognized, but that would prove to be exactly what they needed. What they didn't know was that the quiet night shift nurse coordinating their emergency response was Staff Sergeant Lisa Rodriguez, former Army Ranger medic, who had treated battlefield casualties under enemy fire in Afghanistan and Iraq, and for whom 8 trauma patients in a well-equipped hospital was considerably less challenging than treating dozens of wounded soldiers with limited medical supplies in active combat zones. Lisa Rodriguez, 31 years old, had been working the night shift in Metro General Hospital's intensive care unit for 2 years and 3 months, maintaining the same systematic professionalism that had characterized her 6-year career as an Army Ranger medic. Every evening at 6:45 p.m., she arrived wearing standard nursing scrubs, carrying a well-organized bag that contained additional medical supplies, continuing education materials, and emergency protocols that she reviewed constantly to stay current with civilian medical procedures. The hospital staff knew Lisa as the ICU nurse who could handle any emergency, who somehow remained calm during the most chaotic situations, and who had an intuitive understanding of trauma medicine that impressed doctors with decades more experience. She worked with quiet efficiency that made her invaluable during emergencies, while maintaining the kind of professional relationships that made her colleagues feel confident and supported. What they didn't notice was Lisa's automatic threat assessment when she entered the hospital each night. The way she positioned herself with clear views of all emergency access points. The way she organized her medical supplies with military precision that went far beyond typical nursing requirements. Her approach to patient care was systematic and thorough in ways that suggested training beyond standard nursing education. Lisa had chosen night shift work specifically because it offered the emergency medical challenges that kept her skills sharp while allowing her to serve civilian patients in peaceful conditions rather than combat zones. The transition from treating battlefield trauma to providing intensive care for civilian patients had been exactly what she needed after 6 years of high-stress military medical service. Her path to nursing had been unusual but logical. Lisa had joined the Army at 19, initially planning to serve a single enlistment before using military benefits to pay for college. But when she scored exceptionally high on medical aptitude tests, recruiters had suggested she consider Army medical training that would provide health care skills valuable for both military and civilian careers. What the recruiters hadn't mentioned was that Lisa's test scores and psychological profile had made her a candidate for much more specialized training than typical Army medic instruction. After completing basic medical training, Lisa had been selected for Ranger School, one of only a few women to attempt the program, and one of even fewer to complete it successfully. Ranger medic training was among the most demanding medical education the military offered. 6 months of intensive combat medicine instruction that included everything from battlefield surgery to psychological trauma treatment, followed by deployments where Lisa would be responsible for medical care of elite soldiers conducting the most dangerous missions the Army assigned. Lisa's first deployment to Afghanistan in 2018 had been a trial by fire that demonstrated why Ranger medic training was so intensive. The special operations missions that Rangers conducted often took place in remote locations where medical evacuation was impossible, meaning that Lisa had to provide definitive medical care using portable equipment and limited supplies. Over 3 deployments to Afghanistan and Iraq, Lisa had treated hundreds of combat casualties, performing everything from emergency surgery to psychological crisis intervention under conditions that would challenge doctors in well-equipped civilian hospitals. She had earned commendations for medical excellence under fire, but had also experienced the psychological toll of treating traumatic injuries, while knowing that medical mistakes could mean the difference between life and death for soldiers under her care. When Lisa completed her military service, she had been offered positions with military contractors and trauma centers that would have used her Ranger medic training more directly. But after years of combat medicine, Lisa had chosen civilian ICU nursing because it allowed her to use her medical skills to save lives without the constant stress and danger of battlefield conditions. Metro General Hospital was a Level 1 trauma center serving a diverse urban population that included a significant number of veterans and military families. Lisa's position in the ICU meant she treated the most critically ill patients, but in controlled conditions with sophisticated equipment and extensive support staff, a significant change in the isolated, resource-limited environments where she had practiced medicine during her military service. During her 2 years at Metro General, Lisa had consistently impressed colleagues with her ability to remain calm during medical emergencies, to make rapid and accurate clinical decisions, and provide emotional support for patients and families dealing with traumatic medical situations. Lisa, said to our Angela Martinez, the ICU attending physician, during one of their regular case discussions, your clinical judgment and crisis management skills are exceptional. Your approach to emergency situations seems almost instinctive. Experience with high-stress medical situations, Dr. Martinez. Military medical training emphasized quick decision-making and systematic approaches to trauma care. What Lisa didn't explain was that her experience with high-stress medical situations included treating soldiers with complex trauma injuries while under enemy fire, performing emergency surgery in field conditions that would be considered impossible in civilian medicine, and making life-and-death medical decisions while personally armed and prepared for combat. The night when Lisa's background was fully revealed began routinely. She was caring for 3 ICU patients, a post-surgical cardiac patient, a trauma victim from a construction accident, and an elderly woman recovering from complications related to pneumonia. The night shift was quiet, allowing Lisa to focus on the detailed monitoring and care that ICU patients required. At 11:43 p.m., the hospital's emergency communication system activated with a report that would test every aspect of Lisa's military medical training. A multi-vehicle accident on Interstate 64 involving 2 commercial trucks and 6 passenger vehicles, with multiple fatalities and at least 8 people requiring immediate trauma care. All available staff to emergency department, announced Dr. Patterson, the attending emergency physician. We're about to receive multiple critical trauma patients simultaneously. Lisa immediately volunteered to assist with emergency department overflow, knowing that her ICU experience with critically ill patients would be valuable for trauma care. But as she listened to radio communications from the accident scene, she realized that Metro General was about to face a mass casualty situation that would challenge the hospital's resources and staff in ways that most civilian medical personnel had never experienced. The ambulance crews were reporting injuries that included multiple fractures, internal bleeding, traumatic brain injuries, and at least 2 patients in cardiac arrest. 8 critical patients arriving within minutes of each other would overwhelm the emergency department's normal capacity and require coordinated response that civilian hospitals rarely practiced. Lisa's Ranger medic training immediately activated. She began implementing mass casualty protocols that she had used in Afghanistan when treating multiple casualties from IED explosions or complex ambushes. The principles were the same whether the casualties were soldiers injured in combat or civilians injured in traffic accidents. Rapid triage, efficient resource allocation, and systematic treatment prioritization that maximized the number of lives saved. Dr. Patterson. Lisa said as she approached the emergency department charge nurse, I have experience with multiple casualty situations. May I suggest we implement triage protocols that prioritize patients based on injury severity and treatment requirements. Dr. Patterson, who had been working in emergency medicine for 12 years, recognized that Lisa's suggestion demonstrated understanding of emergency management principles that went beyond typical nursing training. Lisa, what kind of experience do you have with mass casualty situations? Military medical training, sir. Army Ranger medic. I've treated multiple casualties simultaneously in field conditions. Dr. Patterson understood immediately. Army Ranger medics receive training equivalent to civilian trauma surgeons, but with additional experience treating multiple patients under conditions far more challenging than any civilian hospital emergency. Lisa, I'm putting you in charge of triage coordination. Set up whatever protocols you think we need. The first ambulance arrived at 11:52 p.m., carrying two patients in critical condition, a middle-aged man with multiple rib fractures and suspected internal bleeding, and a teenage girl with traumatic brain injury and unstable vital signs. Lisa immediately assessed both patients using triage criteria that prioritize treatment based on injury severity, available resources, and likelihood of survival with immediate intervention. Trauma Bay 1 for the male patient. Internal bleeding requires immediate surgical consultation. Lisa directed with calm authority. Trauma Bay 2 for the female patient. Neurosurgical evaluation and continuous monitoring. Her triage decisions were rapid, accurate, and based on assessment skills that allowed her to identify critical injuries and treatment priorities within seconds of patient contact. The medical staff began to realize that Lisa's trauma experience was far more extensive than typical nursing background. The second ambulance arrived 3 minutes later with two more critical patients, followed immediately by a third ambulance with 4 additional casualties. Within 10 minutes, Metro General's emergency department was treating 8 trauma patients simultaneously, a situation that would normally overwhelm civilian hospital resources. But Lisa had transformed the emergency department into something resembling a military field hospital, with systematic triage procedures, efficient resource allocation, and coordinated treatment protocols that allowed the medical staff to provide optimal care for all patients despite limited resources. Lisa, said Dar, Sarah Kim, the trauma surgeon who had been called in for multiple emergency operations, your triage and coordination protocols are exceptional. Where did you learn to manage mass casualty situations like this? Afghanistan and Iraq, ma'am. Ranger medic training included extensive instruction in treating multiple casualties with limited resources. Dr. Kim realized that Lisa's military experience had prepared her for exactly the type of emergency they were facing. Lisa, I want you to coordinate with me on surgical prioritization. Your assessment of these patients is more accurate than our initial evaluations. The collaboration between Lisa's triage expertise and the hospital's surgical capabilities resulted in all 8 patients receiving appropriate care within the critical first hour after injury. Lisa's systematic approach to mass casualty management had prevented the chaos and resource misallocation that typically characterize civilian hospitals during unexpected emergencies. By 2 a.m., all 8 patients had been stabilized, with 6 requiring emergency surgery and 2 admitted to the ICU for intensive monitoring. The emergency response had been so effective that Dr. Patterson requested a debriefing to understand how the hospital had managed such a complex situation so successfully. Lisa, Dr. Patterson said during the debriefing session, your coordination of tonight's emergency response was outstanding. Our normal protocols would have been completely overwhelmed by 8 critical patients arriving simultaneously. Dr. Patterson, military medical training emphasizes systematic approaches to multiple casualty situations. The principles apply whether you're treating soldiers in Afghanistan or civilians in a hospital emergency department. Dr. Martinez, who had observed Lisa's performance throughout the emergency, recognized that they had witnessed something extraordinary. Lisa, your clinical decision-making and coordination skills during tonight's emergency were at a level I typically see from trauma surgeons with decades of experience. The hospital administration's review of the emergency response confirmed that Lisa's intervention had probably saved at least 2 lives and had significantly improved outcomes for all 8 patients. Her systematic triage approach and coordination protocols had prevented the delays and resource conflicts that could have been fatal during such a complex emergency. But the most meaningful recognition came from the families of the patients Lisa had helped save. Nurse Rodriguez, said Patricia Williams, whose 16-year-old daughter had suffered traumatic brain injury in the accident. The doctors told us that your quick assessment and treatment recommendations were critical for Emily's recovery. They said you knew exactly what needed to be done. Mrs. Williams, I was just doing my job. Emily is a strong young woman, and she had excellent surgical and medical care. Nurse Rodriguez, the doctors said your experience was special. They said you had military medical training. Yes, ma'am, Army Ranger medic. But Emily's recovery is because of the entire medical team working together. The conversation with Mrs. Williams helped Lisa realize that her military medical experience was valuable not just for emergency situations, but for helping civilian patients and families understand and cope with traumatic medical situations. A week after the mass casualty emergency, DR, Patterson approached Lisa with a proposal that would formalize her role in emergency medical training and response. Lisa, I want to offer you a position as Emergency Department Clinical Coordinator. The role would involve developing mass casualty protocols, training staff in emergency response procedures, and coordinating with emergency services to improve trauma care throughout the region. The position will allow Lisa to use her Ranger medic training to improve civilian emergency medical care while maintaining her clinical nursing responsibilities. She would be developing protocols that could save lives during future emergencies while contributing her expertise to medical education and training. Lisa accepted the position, which led to Metro General Hospital becoming a regional center for mass casualty training and emergency response coordination. Her military protocols, adapted for civilian medical settings, were adopted by hospitals throughout the state and became models for other trauma centers. Lisa said to our Kim 6 months after the traffic accident emergency, the protocols you've developed have fundamentally improved our ability to handle complex trauma situations. But more than that, you've changed how our staff thinks about emergency medicine. Lisa's training programs for her hospital staff emphasize the systematic thinking and calm decision-making that characterize military medical training. Her sessions taught civilian medical personnel how to maintain performance under pressure, how to prioritize multiple competing medical demands, and how to coordinate complex medical responses efficiently. But Lisa also began working with veteran patients who were dealing with medical issues related to their military service. Her combination of advanced medical training and personal understanding of military experience made her valuable for treating veterans who were struggling with both physical and psychological challenges related to their service. Staff Sergeant Rodriguez, said Marine veteran Carlos Martinez, who was recovering from surgery related to combat injuries, it means a lot to have a medical provider who understands what military service involves. You know what it's like? Carlos, I understand some of what you've experienced. My job is to help you get the best possible medical care while you're recovering. Lisa's work with veteran patients led to her developing specialized programs for military personnel transitioning to civilian health care, helping them navigate medical systems while dealing with service-related health issues. A year after the mass casualty emergency, Lisa received recognition from both the American Nurses Association and the Department of Veterans Affairs for developing medical protocols that improved civilian emergency care while supporting veteran health care needs. Her story was featured in military medical publications as an example of how specialized military training could be applied to civilian health care challenges. But Lisa's focus remained on her patients and her continued development as a medical professional. Dr. Patterson, Lisa said during one of their regular meetings, I think I've learned that military medical training doesn't end when service ends. It just finds new applications that serve different populations. Lisa, your work here has saved lives and improved medical care for everyone we treat. Your military experience didn't just prepare you for battlefield medicine. It prepared you to be an exceptional civilian medical professional. 2 years after the traffic accident that revealed her background, Lisa had become Metro General's Director of Emergency Medical Services, responsible for trauma protocols, staff training, and coordination with regional emergency services. She continued working night shifts in the ICU, but also developed programs that prepared civilian medical personnel for complex emergency situations. The most important aspect of Lisa's work was her mentoring of other veteran medical personnel who were transitioning to civilian healthcare careers. Her example of applying military medical training to civilian nursing inspired other former military medics to pursue healthcare careers that used their specialized training. The key, Lisa explained to a group of transitioning military medics, is understanding that the medical skills you developed in the military are directly applicable to civilian healthcare. The difference is that you're treating patients in safe, well-equipped environments rather than dangerous, resource-limited conditions. Today, Lisa Rodriguez continues working at Metro General Hospital, where she serves as both ICU nurse and Director of Emergency Medical Services. She still works night shifts, still provides care for critically ill patients, and still responds to emergency situations with the calm competence that first impressed her colleagues during the mass casualty incident. But she also trains civilian medical personnel in emergency response procedures, develops protocols that improve trauma care throughout the region, and mentors military veterans who are pursuing civilian healthcare careers. The emergency department where Lisa coordinates mass casualty responses displays a small plaque that reads, "In recognition of medical professionals who serve with distinction in both military and civilian settings." Lisa requested that the plaque honor all veteran medical personnel rather than individual recognition. Lisa's story reminds us that military medical expertise doesn't diminish when applied to civilian healthcare, it enhances. That Army Ranger medic training can improve civilian emergency medicine just as effectively as it saves lives in combat zones. That the same systematic approach used to treat battlefield casualties can be used to develop better protocols for civilian trauma care. The next time you receive care from a nurse or medical professional, remember Lisa Rodriguez. Remember that they might have medical experience gained in situations and places you can't imagine. Remember that they might have chosen civilian healthcare, not because they lack other qualifications, but because they found meaningful ways to apply extraordinary medical training to serve civilian patients. Sometimes the most important medical interventions happen not in combat zones or field hospitals, but in civilian emergency departments where former military medics choose to use their expertise to save civilian lives with the same dedication they once showed to wounded soldiers. Sometimes the greatest medical expertise belongs to people wearing nursing scrubs rather than combat uniforms. People who've chosen to apply battlefield medicine to civilian healthcare, ensuring that the skills developed for saving soldiers can be used to save civilians. We need to recognize and appreciate the skilled medical professionals among us who've chosen to serve quietly, especially those whose previous medical service required treating trauma in dangerous places, so that civilians could receive medical care in safe places. Because true medical expertise doesn't disappear when uniforms change, it just finds new applications. And sometimes the most valuable medical training involves not treating combat casualties, but applying military medical protocols to civilian emergencies, ensuring that the systematic precision developed for battlefield medicine can be used to improve health care for everyone.